Whenever you're ready, Alicia. Thanks for joining us.
Okay. Can I start? Yeah?
Yeah.
Okay. Good morning, everyone. I'm Alicia. I'm from Lipesca here in Manaus, from the Hospital of Tropical Medicine. And I'm very happy to be here again. I think discuss this kind of research and this kind of reflection is very important in our area. So today I'm going to try present this article that we have choose in the last year. So the article is called Culturally Responsive Methodologies, Addressing the Special Issues in Qualitative Health Research. Okay, now next. Let me just try here just a second, Leticia.
Okay.
I don't know how I can pass for the next. Now,
Maybe with the mouse.
yeah, no, I'm the next, but I didn't.
Do you wanna try share your screen again?
Now it's okay.
Yeah.
So why is it important to consider the issue now, the qualitative responsive research? Uh, nowadays, there are amount of evidence of the social determinants of health, and we know that our health is shaped not just by the biology component, but also by social factors, as access to basic sanitation, drink water, and territorial protection, especially in indigenous land, and also. We have to consider the culture and the views of lives when you think in our health. And during the COVID-19 pandemic, this was exacerbate the global health disparities, especially because the virus didn't affect everyone equally. So here in Manaus, we saw a thousand people died, and the poor people were the most impacted during this pandemic. And so the spread and severity of the disease were compounded by the complex interplay of political, social, and cultural values and institutional discrimination. Also, we as research, we are facing nowadays a growing polarization in science. We are living the skepticism versus the science. And these are increasing the health misinformation, damage the trust in healthcare, and also lowering health literacy. In this scenario, the culture is the heart. It's like it is the core, because the culture shapes our public perception, our perception about the life, about the disease, about the health, and also in the engagement with healthcare, the politicization of healthcare, and the responsiveness of healthcare systems and research and practices. So the qualitative research in this scenario are called on to develop an holistic and cultural rounded practice that are responsible to, how can I say, to responsible, just a second. Oh my God. Are responsible to the diverse communities assessing healthcare. Thinking in this article, the author in this article, they proposed a culturally responsive qualitative research. And the term in this research, special issue, is just a purposeful play on word that underscore the significance and urgency of cultural responsive in health research. So in this article, they choose some article and divide in specific themes, in different themes, uh, for things they consider important to reflect and you thinking about when you are uh, working with qualitative research. So what is exactly responsive qualitative research? The CRQR is not just a method. It's comprised a spectrum of methodologies, practices, and ethical stance that establish the critical role of culture in every inquiry. So, and the CRQR was shaped by three early movements. So we have the cultural competence, the cultural humility, and the cultural safety. The first is focusing on and educate professionals about other cultures, but the limitation is that they treat the culture as something fixed and homogeneous, and the culture is not like this. The second is cultural humility. So, in this movement focuses on self-reflection, on personal biases, but the limitation is that they still focus on in the individuals, not in system, and how these systems affect the people. And the third and the last is focused on and recognize colonialism and the impact on indigenous health or Black people, or in Brazil, we have the Quilombola people, or this movement is focusing on this, but they have a limitation about the determination and power of the analysis. So the CRQR is a spectrum or a methodology that propose a shift from the culture blind to a culturally grounded. So qualitative health research has moved from ignore culture to use responsive frameworks. And the CRQR have some principles, yeah? So the first is that no research is universal or so objective or neutral. The research have to think about the biases, about the subjectives, and this kind of methodology. And also this methodology also encouraged critical self-reflection. So you have to think how you see a specific group, how you consider, and how you will analyze the data. So the methodology bring this to us. And also, the CRK avoids stereotypes, especially with marginalized communities, as I say, indigenous, riverine, Black people, women, and quilombolas. And also, the CRK is based in a kind of research with people, not on the people. So it's something very important, this, the co-development of a research with the group. And the CRQR is always thinking about who is benefit from the research. So it's very important that the thinking the benefit and the effectiveness benefits from to the people. So in this article, the author, they include many articles, if a broad spectrum of the health science and diverse subfields, just to to the research started to understand this in different contexts and different geographies, and it started to engage with this context and this this. So there are two areas that the author considered very important to consider when you think about this methodology is understand the meaning of the culture and the hierarchy and what did the culture represent for the people, and the other is consider the hierarchy as a framework. Yeah. So they divide this article in some themes and some sections and put some articles in these themes, in these sections. So the first is critical intersection and cultural reposition. So the main idea in this is the shift from study the other to analyze how determinant cultural norms can constrain and dehumanize. So in this theme, they started to speak about how we have to reflect about how we see the people. Or for example, I'm an indigenous person, I'm an indigenous research, and was sometimes it's really hard speaking with anthropologists because they don't see sometimes me as a research. It just with other like someone distance, someone to study, someone to understand how this kind of people see the world or how they eat, how they take care, something like this. So this methodology bring this to us, this reflection. So, in this theme, we have three articles. So, in the first is an article focused on the transparency in New Zealand and how the cisnormativity and transphobia increase the health disparities and the access of healthcare. The second is about health justice partnership in Australia, and the main idea in this study is how colonial norms compound social exclusion, especially in Australia, where we have a lot of Aboriginals people and immigrants. And the third is about mental health in India. And the main idea in this study is how neoliberalism and plus colonialism created and dehumanize care environments. So the second theme is called cultural complexity of language in research and health. And the main idea in this theme is speaking how language is important for the people. So language is it's like the core of the culture. It's central to culture, identity, and worldview, but often it's ignored in English dominant research. So we are for example, here in Brazil, we have a lot of language, native language. Portuguese is not the first language for many people. So when you start to work with these people, sometimes it's really complicated translate some meanings. For example, I work with trachoma with Crow people in Tocantins, here in the Brazilian Amazon. And this word, this disease, trachoma, didn't exist in their vocabulary. So how can I translate this for they understand or we're all lost the meaning of disease. So this theme is about this. So in the first article, they speak how translation is political. The translation for English, it's something political. It's not just technical. And the second article, he speaks about language choice in interviews and how no native language interview create cognitive and emotional talents because it's really hard try understand a people or try understand for example, indigenous people in other language, for example, in Portuguese sometimes. And the third article is about refuge in Israel, and the main idea it's how cultural items of distress are dynamic, not fixed to Western diagnosis. So the third theme that they divide in this article is call it disrupting power-centered stories. So the main idea in this is how CRQR fights epistemic injustice by prioritizing voice of marginalized groups. So this is about consider voice that always were considered invisible, for example. So they work with Black people in Louisiana, Filipino Americans, and LGBTQ people with multiple sclerosis. So this is about this. Consider this voice. Started to listen this kind of voice with sensibility. The last theme is called culturally responsive evaluation. And this theme is about when you want to evaluate something, you have to consider a culturally responsive methodology. So they brought two articles, and the first is focusing on the evaluation of a vaccine program in rural Georgia. And they based this evaluation in art strategies, building trust. And the second is an article focusing on in young parents support groups, and they conclude that they need for more reflexive methods and flexible methods. And for conclude this article, this special issue show how the culture have a central is important to consider when we are thinking about different groups, especially in the moment that we are living in the world. So the main idea in this article is this. We have to stop to treat the people and the participants of research like the other or a object and consider as a person, as a people, as a group. So, and also stop to see the people for a Western lens, European lens. I don't know how to say this in English very well, but it's something like this. And really engage with the culture, power, and voice. This is the main idea of this article. So, and this kind of research is not a just like good for the people. It's necessary, especially in the moment that we have living nowadays. So that's it. Thank you very much, and now I'm open for the question and the discussion. Thank you.
Thank you. Any comments, questions for Alicia?